Most people think a heart attack begins with sudden chest pain, but that is not where it starts. A heart attack usually begins years, sometimes decades, earlier, long before symptoms, long before diagnosis, long before anyone realizes there is a problem. To understand how a heart attack happens, we must first understand the artery. A healthy coronary artery is smooth, flexible, and lined with a thin protective layer of cells called the endothelium. This layer does more than just act as a barrier. It regulates blood flow. It releases nitric oxide, which relaxes blood vessels. It prevents unwanted clotting. It keeps inflammation under control. As long as this layer remains healthy, the artery functions normally. But when this protective lining becomes damaged, the process begins. The endothelium is extremely delicate. High blood pressure creates mechanical stress on the artery wall. Smoking introduces toxic chemicals that directly injure endothelial cells. Diabetes exposes vessels to high glucose levels, causing glycation damage. Chronic inflammation and poor diet contribute oxidative stress. Over time, this stress weakens the endothelial layer. Tiny microscopic gaps appear. You cannot feel this. There are no symptoms. But the barrier is no longer fully intact. And that changes everything. Low-density lipoprotein, LDL, carries cholesterol through the bloodstream. Cholesterol itself is essential for life. It builds cell membranes and hormones. The problem is not cholesterol alone. The problem is location. When the endothelial barrier is damaged, LDL particles slip through microscopic openings into the artery wall. Once inside, they become trapped. And in this environment, LDL undergoes oxidation. Oxidized LDL is no longer harmless. It becomes chemically altered, and the immune system sees it as a threat. When oxidized LDL accumulates, immune cells called macrophages migrate into the artery wall. Their job is to clean up harmful substances. They engulf the oxidized LDL. But when LDL levels are high and damage continues, macrophages become overloaded. They fill with lipid droplets. They swell. They transform into what we call foam cells. These foam cells accumulate along the artery wall, forming fatty streaks. This is the earliest visible stage of atherosclerosis. Still no symptoms. Still silent. But the structure of the artery is now changing. As inflammation continues, smooth muscle cells migrate and multiply. The body attempts to stabilize the area by forming a fibrous cap over the growing lipid core. This creates what we call an atherosclerotic plaque. Over time, plaque enlarges. The artery lumen, the open channel where blood flows, gradually narrows. Blood flow may remain sufficient at rest, but during physical activity, when the heart needs more oxygen, supply may not meet demand. This can cause chest pain, known as angina. But here is something important. Most heart attacks do not occur because of gradual narrowing alone. They occur because of sudden rupture. Not all plaques are equal. Some plaques develop thick, stable fibrous caps. Others develop thin, fragile caps. These thin cap plaques are called vulnerable plaques. Mechanical stress, inflammation, and internal pressure can cause the fibrous cap to rupture. When it tears open, the inner lipid core is exposed directly to circulating blood, and the body reacts immediately. Platelets rush to the rupture site. They adhere to the exposed tissue. A clot begins forming. Fibrin strands create a mesh that stabilizes the clot. If the clot grows large enough, it can completely block the artery. Blood flow stops abruptly. The heart muscle supplied by that artery is suddenly deprived of oxygen. Within minutes, heart muscle cells begin to die. This is myocardial infarction, a heart attack. It is not the slow narrowing that causes the emergency. It is the sudden clot. The most important lesson is this. Heart attacks do not begin suddenly. They develop silently over years. The process begins with endothelial damage. It progresses through LDL infiltration. It advances with chronic inflammation. It builds into plaque. And it ends with rupture and clot formation. But here is the hopeful truth. Every step of this process is influenced by lifestyle and risk factors. Blood pressure control, cholesterol management, smoking cessation, diabetes control, physical activity, nutrition. The biology of a heart attack is complex. But prevention begins with simple decisions made daily. Understanding the process gives you power. And prevention is far more powerful than emergency treatment. A heart attack is not a single moment. It is a story written silently inside your arteries. And now, you understand how that story begins.